Next slide, Jim. So what is our proposed strategy, right? So we got some ingredients for success, and by all means, these are just a few that we've listed, and which is why you're here, because we want your input. So access to current and accurate information, right? We want to make sure that we're all one band, one sound, giving out the same information always. And that's important because sometimes when you have different messaging, people get confused and they don't really know how to go about doing what's necessary. There's the identification engagement of trusted messages. Who are the people that are going to be delivering the messages? That's why I've invited you guys all here today, so that you can deliver the message and we can be consistent in what we're saying, so that we can achieve the ultimate goal. Remember, is always so that people have insurance, and then those that don't have insurance, we're able to get them insured as well. Develop the development and effectiveness of accurate messaging. So we're going to make sure that we have a sound and credible toolkit to be able to get this messaging out to the community. We're coming up with a term, something to the effect of community ambassadors, where we'll be spreading awareness, and we'll talk about that further. There's also the activation of opportunities to engage in target populations. What does that mean? Well, we know that we have people that may have disabilities, so we want to make sure that that area and population is aware and getting the care that they need. We also know that people that are on Social Security, or we have some people that are on all Social Security disability, they're all different types of target populations. And we want to make sure that we're getting to those individuals as well in partnership with New Jersey Family Care. What are some of the potential strategies that we plan to use? We want to create, train, and hopefully be able to compensate a team of community ambassadors to do these trusted messages, right? So I know I'm a community ambassador. I try to get the information out there and be consistent, and we want you all to be community ambassadors, but we definitely want to be able to create teams of people to be able to deliver this message consistently over these next few months in particularly. And we want to offer incentives to individuals who actually complete the insurance enrollment. That's important too, to be able to do that. So that's the strategies that we've come up with so far, and then we'll talk a little further. Next slide. All right, that's the slide. So I got through them pretty quickly. I'm gonna take a pause really quick because I'm ahead of time. I apologize if I talk too fast, but hopefully you got the gist of what we're doing. And anybody having, I know it's a lot of questions in the chat right now, but what I would like to do is, I'll allow Iris first. She's from Horizon. If she wants to add anything to the information that I've already shared.
Hi, Yolanda, and hi, everyone. Thanks so much for the opportunity to engage in the conversation. And just want to thank everyone for joining and having these discussions, because we really need to leverage each other's partnership in order to get the messaging out and get these folks to renew their coverage. Having their coverage is essential to keeping them healthy and thriving in the community, right? So we really do need to lean on each other as part of these efforts. Yolanda, I think you did a really great job covering the overall messaging around it. I think more so the urgency of making sure that folks update their contact information, update their addresses, phone numbers, if they had a new baby, any of that information that's pertinent, what numbers to call, right? They have to call the state 800 number. And then again, the visual reminders are really important, right? If you do get large folks, number of folks coming through either a clinical space or a food pantry or your churches, the printed materials are also great visual reminders. So again, for both the recertification and for Cover All Kids, any of these flyers, I would suggest that people put them up, because the more folks see it in different spaces, the more that serves as a reminder, right? And that overhear psychology of seeing the messaging over and over again.
Thank you, Iris. And I know, is Laura still on? Laura, okay. So Laura, would you mind just sharing a little more deeper in terms of the Coverall Kids? Because I know when we last met, you had some data in terms of where we're at.
Come on. Sure, no problem. So in regards to Coverall Kids, the great news is that since the expansion of it, I should say, to undocumented children from January happened till about last week, we now have enrolled 5,404 children. So we started with about 16,000 eligible children who are undocumented and eligible for New Jersey Family Care. And so now we've got 5,000, almost 5,500 of those children who have been enrolled in coverage. So that's amazing. If we keep at it, we will have these children enrolled before long, which is a wonderful thing. But again, with all of your help through this coalition, through this group, through all of your outreach into these communities, we can get some great progress into, trying to get these kids to start school now with coverage in this coming school year. So I just wanted to share a little bit about that. There's some flyers. If anyone needs some outreach flyers, we certainly have some that we can share if you don't already have your own. And yeah, it's just been great to see and long time coming. When Coverall Kids, the legislation passed, since it passed in, I think it was 2020 or 2021, I believe now there was a total of about 90,000, 80 and 90,000 children who were uninsured. And since then, I believe we've enrolled about 50 to 60,000 of those children. So the work is, it's been working. So we'll love for all of you to keep the momentum going.
Thank you, Laura. I appreciate that. So we have some experts on here. So remember these names. You got Evelyn Acevedo, you have Iris Coney, you have Laura Waddell. Forgive me if I've missed any of the other HMO partners for NJ Family Care. The next thing I would like to do is my colleague is going to assist me with some of these questions in the chat. So Nikki.
Hi, everyone. Good afternoon. I appreciate you all using the chat feature. And then some of you are also using the question and answer feature on Zoom to submit your questions. So I'm just going to take a moment. Feel free to keep them coming in to just read out some of the questions in the order that we've received them. And then Yolanda will either answer the question or direct it to the right person. So our first question in the chat is, what would happen if the resident doesn't have the documents necessary to complete recertification? Meaning birth certificate, social security number, ID, etc.
Iris, would you mind taking that?
No, absolutely. So in part, there were a couple of revisions made to the actual application online. So once you start inputting the information, I believe it was in the date of birth section. So if that date of birth falls within the range of 19 years and under, right, it would then default to taking out that section where the social security is required. Evelyn, correct me if I'm wrong, but there's certain fields that are eliminated if based upon the date of birth, right? Again, if you're 19 years and above, it would ask you for specific, social security number or some type of identification number, right? But for children, it would not. require it. Evelyn, am I correct in saying this?
Yes, you are. I was looking for, I have a sample of the application of what it looks like. I was going to try to display it for you. But yes, you're correct.
Awesome. Thank you so much, Ev. And Yolanda, I have some of the infographics from the state in regards to the recertification and the coverall kids. Is this something that you'd like me to share with you, to share with the group, or do you want me to try to drop it in the chat box? You're on mute, love.
Sorry about that. Could you drop it in the chat and then email
Yeah,
it to me as well so I could distribute it more broadly?
Of course. Yep.
Thank you, Evelyn and Iris, for that. Nikki, next question.
Yes, so we have another question asking about the slide presentation and if that will be sent out. And I appreciate my colleague Gemma for answering that in the chat box. So that will be sent out after. So thank you for asking that question if that's on anyone else's mind. The next question is, if your child already has coverage, do they need to recertify?
Yes, I can answer that.
Okay.
Also,
Next.
you know what, Yolanda, I forgot to mention that joining me is our Director of ACA Enrollment, Gabrielle Escribano. So she's also a resident expert too on all things enrolling in coverage, whether it's New Jersey family care or on Get Covered ACA plans as well. So if anyone has some questions for her, I put her on the spot and I'm offering her up too.
So before we move to the next question, I didn't know she was on. Would you like to share really quickly, Gabrielle?
Sure, if possible, I actually wanted to ask Iris and Evelyn, that portion about the social, at least for us, when we are enrolling children, regardless of the date of birth, they ask for a social for every person in the household.
Sure. Ev, can you just help out with that? I'm sorry, Gabrielle. I usually handle the health education piece, but Evelyn is the subject matter expert and
No problem. That's why we're working together. If there's a way to, not have to deal with that, I would love to know.
Yeah, so there is, when we're, as Iris mentioned earlier, due to covering all kids, they did make a change on the application process. So when you go to the part where the date of birth is, it'll ask you if the child has a social security or not. If you click no, you can continue on with the application. It will not stop you.
Yes. Okay.
Okay.
Mm-hmm.
And I have samples of what the application looks like. If you'd like, I could, I did screenshots because I'm currently doing training, in-house training for, Horizon employees. So if you need some copies of, the screenshots, I'll be more than happy to email them over to you. Just to give you an idea of what it looks like.
Thank you, Evelyn. That would be very appreciative and helpful.
Sure.
And thank you for the questions. We'll keep going.
Yolanda, I just want to make sure that it went through. I just dropped the information in the chat box. It's one large PDF with different either NJ family care information, the recertification,
Yes.
and the coverall kits in one PDF.
Yes, we see it.
Cool.
Thank you so much.
You're
Appreciate
welcome.
it. So make sure you guys are checking the chat for the things that are being dropped in there for reference.